Thanks very much. It's always a pleasure to be at Macaulay House, or really at any program Sisters of Mercy sponsor, I have to say. So why don't we start with the numbers that we're dealing with. Well, anytime I present these numbers, I like to preface it by saying that each one of these numbers represents a unique individual person with their own story about how they became homeless, why they became homeless. Every single person is different. So the fact that I'm giving all these aggregate numbers shouldn't imply that those unique stories aren't important. They're very important. So on an annual basis, in 2011, 4,410 people, unique individuals, were in a shelter or transitional housing. That included more than 1,000 children, almost 700 adults and families, and the largest group, single adults, which I think you mainly deal with here, 2,641. If we just look at what we call a point-in-time count, so one night in January, and we pick January just to try to limit the number of people who would be outside, so it's a better count. One night in January at 1,141, you can see the other numbers there. Unfortunately, the 2012 number is higher, it's 1,277. An obvious question is, why are there so many homeless people in Rhode Island? Usually people have all sorts of things they say about homeless people. They're this, they're that. They're mentally ill, they have drug or alcohol problems, they're lazy. You name it, it's the first thing that comes to people's minds when they think about homelessness. But how about the fact that our housing market does not deliver housing that's affordable to the majority of people in our state? And I think these numbers show that I'm not exaggerating. Back in 1980, the average apartment went for $161 a month. I often talk to my students. We were just talking about my being in grad school. When I was in grad school in Chicago, a very expensive rental market, I actually paid $37.50 a month. So I had 3 roommates. The rent was $150. The rents went skyrocketing in the 80s and have continued to escalate ever since. They've come down just slightly in the recession, but in 2010 the average rent was $1,165 a month. That's for an available 2-bedroom apartment. To afford that, you really need to make $47,000 a year. Just about half of all the households in Rhode Island do not make that. And the people who show up at Macaulay House, you're talking well below that, right? So really, it's primarily the fact that we don't have affordable housing. It's a case of market failure. It's not personal failures, it's the failure of the market. I mean, I don't know how you could argue that. The median rental household income in Rhode Island is about $30,000, well below the ability to afford a 2-bedroom apartment. Lately, things have only gotten worse. The top line is the poverty rate, which is at about 14% right now. The middle line is the unemployment rate. It's easy to forget that in 2007, as recently as the middle of 2007, the unemployment rate in Rhode Island was at 5%. Now it's more than double that. It's not just 11% in 2010, it's continued to be at 11% since then. It's still 11%. And the bottom line is the foreclosure rate. Anything over 1% is very high. That's what we reached in 2008. It's just about at 1% now. This is one of my things that I really think is extraordinarily important, and there are a lot of other people who do research on homelessness that neglect this seriously. The National Alliance to End Homelessness is not one of those groups. This is a number of people who are involuntarily doubled up with other people, mainly in apartments, due mainly to economic reasons. 2008, it was 6,600. In 2009, 12,500. And in 2010, that's the most recent data we have, 16,258. So this is the feeder group for homelessness. And homeless people do not generally just stay in shelters. They stay outside, they stay in shelters, and they stay in doubled up situations. Then at the beginning of the month, they go to hotels and motels. So it's really those 4 different places, and people tend to circulate among those places. So shelters is only telling you one thing, 4,000 people in shelters. Okay, fine. There's 16,000 people doubled up who don't want to be doubled up. So it's a much larger problem than the shelter numbers would tell you. So I won't go into what every one of these lines represents, but these are the resources devoted to ending homelessness in Rhode Island, federal and state resources, all sorts of different programs. And you can see the resources peaked in 2005 at just over $20 million, largely in response to what we've done with what's called the Neighborhood Opportunities Program, which is the primary state-sponsored, extremely low-income housing production program. So if you're on SSI, that program will get you an apartment for just over $200 a month. If you're a family with a very low income, you can get an apartment for like $400, $350 or $400. That's a really important program. But you can see, as things have gotten worse and worse over the last 3 or 4 years, what's been happening, the resources have actually been cut. So since 2005, everything's going down. That's what that top line represents. So that now we're just over $10 million per year. At exactly the point when we need the most resources. And so here's the number of homeless people in Rhode Island from 1995 to 2011. And here's the key thing here. This is what people miss. We were reducing the number of homeless people from over 5,000 to just over 4,000 between 2004 and 2007, exactly when we were increasing the resources to deal with homelessness. So this shows we can reduce and potentially eliminate homelessness if we simply devote the resources to it. But we stopped doing that, and what happened? Homelessness started to increase again to that number I suggested earlier of 4,400. So let's be the first state to end homelessness. I'm not kidding. There's no reason why we can't do that. The last one I count, actually 1,277 people. That's not that many people. And as I'm going to say later, it actually would save us money to eliminate particularly chronic homelessness. Save us money. And I can prove that. I will prove that a little bit later. And we know how to end chronic homelessness. It's through Housing First programs, like Riverwood Mental Health, which has a collaborative program with Macaulay House, in fact, which I'll tell you, the Riverwood clients think is great. They love you. They love Macaulay House and your program. I'm not just saying that. That's what they say when I talk to them. So Riverwood is ending chronic homelessness by simply putting people into apartments and then having wraparound social services to give them whatever they need to stay there. So we can end long-term homelessness. We can move people out of shelters. Why are people living at Harrington Hall? Why, especially today, there's no air conditioning in there. It's going to be it's probably 110 as we speak. That's what it is. Or 208 Prairie Avenue, not far from here, that urban league shelter. Why are people living there for 5 years, 6 years at a time? That's really unacceptable. And it's not even cost effective. It's morally wrong by any religious tradition I can think of, and it costs us money. So let's stop it. We also know now how to use outcome measures to ensure accountability, to prevent shelters from simply warehousing people. I mean, that's the way shelters used to get funded. Some of them still do. They say, oh, we served 6,000 people this year. Give us money. Yeah, well, what happened to those 6,000 people? You know, if you're a program designed to end homelessness, well, we actually count homelessness by counting people in shelters. Well, you didn't do a very good job, did you? They're still in your shelter. So now we're moving toward turning the screws on those kinds of programs so that they have to move people into permanent housing or they're not going to get funded. And we'll eventually shut down the programs that warehouse homeless people just to fund whoever's working in their organizations. That's the idea. And I think we're starting to get buy-in from certainly Macaulay House, I have to say, but other service providers, and we'll talk more about the General Assembly, but at least the next level down from the General Assembly, the Interagency Council on Homelessness, the Housing Resources Commission, they're committed to doing this. The Office of Housing and Community Development is very much committed to everything I just said. So the long-term vision, ending all forms of homelessness, that's going to take a long time. But the second part should not take that long. House permanently all of the long-term homeless persons in Rhode Island. Shut down these shelters, get people who've been living for 5, 6, 7 years in these shelters into apartments. Stop anyone from entering that kind of situation again. So make sure no one is chronically homeless again, ever. And then particularly ending homelessness among veterans, where we have a lot of resources, and it's completely indefensible to have people in these wars, experiencing this violence, coming back with sometimes an inability to get a job or get housing, and to have them on our streets. Come on. That's not acceptable either. And families, I mean, children, 677 children, homeless. No, that's not right. No, it's 1,092. So to do this, we need to continue prevention programs. I know you do some of that here too. So short-term help with the rent or mortgage to keep people in their apartments, mainly apartments, to prevent them from showing up at shelters. Once particularly families show up at a shelter, you move them immediately into housing. I already mentioned housing first in terms of dealing with long-term homeless people. To do this 4 and 5, here are the big problems, things we're not doing at the moment. Building or rehabilitating deeply affordable housing through programs like the Neighborhood Opportunities Program I mentioned earlier. And of course, the state has continually cut the funding for that over the last few years. Providing rental subsidies. If you're not going to build or rehabilitate housing, provide a voucher, some kind of rental subsidy, so someone with no income or on SSI can afford to live in an apartment. Come on, what kind of society says, oh, you don't have enough money, so you live on the street, or you live at Harrington Hall when it's 115 degrees? Doesn't make any sense. The non-housing resources, certainly jobs, job training, supportive employment, where you provide services to support people in new jobs. Prison reentry programs. It's almost like a revolving door between homelessness and prison. We could talk about that if you want, where homeless people have these fines. You don't just get a jail term, you get a fine. Then you can't get a job when you get out of jail, so you can't pay your fine. So you don't show up at court because you can't pay the fine. So then they swear out a warrant for your arrest, you're back in jail. And you know what homeless people tell me about that? They say, well, the people at the ACI need us back there so that they still have their jobs. That's what they say. Homeless people are actually pretty smart about how all this works. The SOAR program, which puts people on SSI or SSDI, disabled people, immediately, just like Housing First. That really should be part of the Housing First program, and it is. The program's in Rhode Island. Immediately get people on that kind of income support. Certainly child care, that's important for the families, health insurance and health care and behavioral health care access. One of the reasons why Housing First programs work is because they have psychiatrists, literally with office hours, that prescribe psych meds to people. So they're not self-medicating on the street. They get their psych meds for anxiety or depression, whatever their disorder is, and then they can function. They don't have to buy drugs or pills on the street. And then they're stable in their housing. Pretty simple. So we need resources from diverse sources. I won't go through all of this, but certainly federal, state, local. I will mention that. Public housing authorities, they should be opening up apartments for homeless people. And that should be a priority. They're just starting to work with us, but they need to come forward with more units. They haven't really been too forthcoming up till now. Certainly private foundations, United Way, hospitals, universities, Rhode Island housing, churches, certainly the nonprofit sector, like Macaulay House. I already mentioned this. So state resources, the main thing we need right now are either operating subsidies or rental subsidies, service funding to fund those wraparound services for those Housing First programs, and construction and rehab programs for very low-income housing. We just got nothing in the budget on all of this, nothing at all. You may have noticed, they did fund, they put on the ballot a $25 million housing bond, which is great for middle-income people, but will do nothing at all for very low-income people. So I love this. I will never do this presentation without this chart. So here are the projected changes in homelessness if we actually do put the resources into this plan to end homelessness. Homelessness is going down very dramatically. So from the bottom line is chronically homeless people. From 135 people now down to 0 in 2016. Families from about 184 families now to about 70 in 2017. And the green line is individuals not chronically homeless, so that would go from in the 500 range to 336, and you can see the total from about 1,200 down to 500. Over the next 5 years, if we simply devote the resources we need. And those are the annual figures, the same thing, obviously the same kind of reduction. So, why should we do this? I think we should do it for moral reasons. Everybody on this board obviously agrees with me, or you wouldn't be on the board. So even if it costs a lot of money, I would argue we should do it. But literally, ending chronic homelessness would in fact save a lot of money. So I've just been matching the Homeless Management Information System, that's the database, with all the people who show up at our shelters and transitional housing. People in transitional housing are still homeless. With the Medicaid database, okay? And there are 10 of them actually, so I had all 10 of them. And we matched the people. We found there were 2,203 people who were a match between the two databases, if we go back to the beginning of 2010. Then I just took the top 22, less than 2 dozen, chronically homeless people with the top Medicaid billing. Okay? Back to the beginning of 2010. That's the bill right there for 22 people. $4,784,847. So these people at General Assembly are telling me to my face, well, we just don't have the money. We don't have the money. Well, guess what? You are already spending the money. You're just throwing it down the toilet through these huge Medicaid charges, through things like ambulance runs, multiple ambulance runs, emergency room admissions, hospital stays, and then when you're done with your hospital stay, you're discharged to a nursing home. And you're running up millions of dollars just from a couple dozen people. So don't tell me you don't have the money. You're already spending it. It's from their own records. And again, only about a third of these people are a match. So what about the other 2/3? All of whom are going to be on Medicaid in 2014, unless Romney wins the election. We'll talk about that. But if Obama wins the election, and we still have a few Democrats in the Congress, all of those people are going to be on Medicaid. So then you're looking at more like, tens of millions of dollars in these Medicaid charges. So that's about $100,000 per person per year. And that's compared to, I looked at disabled adults in general. They cost only $24,000. Or people in general on Medicaid, they cost only $10,000 a year. So being homeless and being chronically homeless adds a lot to your Medicaid bill. You have chronic conditions that are related to your being on the street and in the shelter system. So the research indicates from Massachusetts, and I will eventually have these exact numbers too, but just from Massachusetts, they show you save 2/3 of your Medicaid expenditures by putting people in Housing First programs. So, do the math. That's $3 million. And they tell me, oh, we don't have any money for you. Yes, you could do that. And this is what we're going to propose to the General Assembly and to Stephen Constantino, who runs Human Services. We're going to show them these numbers and say, you need to start thinking about funding rental subsidies, housing production programs, and we're going to start with services. So allow Medicaid to reimburse for those wraparound services. And that will save you money if you can give us some vouchers to put people into housing. This is from Sean Donovan, the Secretary of Housing and Urban Development, referring to Housing First programs. Now that we know how to house anyone, we must house everyone. Kind of like that quote. So I think this is a no-brainer, and we can do it. It's not impossible. Up in Worcester, they actually were able to turn a lot of their resources from HUD into rental vouchers. And they had like 160 chronically homeless people. They started just putting them in apartments, and they reduced it to four people. It's not impossible. It's very, very possible. So if they can do it in Worcester, we can do it in Rhode Island. The numbers are very similar.